Hello, my name is Emily Bowler, and I am a Program Support Officer for the Mentor Initiative. The Mentor Initiative is an international NGO specializing in vector-borne disease control in humanitarian settings. I will be presenting on the large-scale rollout of innovative disinfection kits to health facilities in conflict-affected Nigeria. Northeast Nigeria has been experiencing a protracted humanitarian crisis since 2009, severely impacting the ability of citizens to access essential services, including healthcare services. In 2019, 7.1 million people were in need of humanitarian assistance in Northeast Nigeria. Nigeria is a highly malaria-endemic country, and there was significant concern that the COVID-19 pandemic would further exacerbate the burden on limited health facilities, particularly in Borno State. The fact that 1 in 4 in Borno State are under the age of 5 is another cause for concern considering the severity of malaria in young children. The rationale behind the distribution of disinfection kits to health facilities was to help in strengthening the health system, to test and treat all patients, including malaria cases, and to enhance the attendance of healthcare providers, thus improving case management and disease surveillance in general. The kits allow the facilities to maintain a sanitized environment during a public health crisis in order to continue services while protecting patients and providers. To date, there is no standardized disinfection kit with essential cleaning products for health facilities in humanitarian emergencies. Neither has there been publicized research on the use of non-worded pictograms for mass use across multiple languages that aims to improve health facility hygiene. This research will provide the foundation for how feasible and successful uptake of disinfection kits will be and the possible impact on health services. The Mentor Initiative, with in-kind support of disinfection kits by SC Johnson and financial support by the United Nations Foundation Nothing But Nets, distributed the kits to 100 health facilities run by 8 partner organizations and the Ministry of Health, including 92 primary healthcare facilities and 8 general hospitals. The kits were distributed in 2 categories, Kit A and Kit B. Kit A was designed for primary healthcare facilities, and you can see here the contents and an image. Kit B was designed for hospitals and contained larger quantities of disinfectant, trigger bottles, wipes, and nail brushes. Hospitals received both Kit A and Kit B. The kits also contained well-designed pictorial messages to enable easy understanding of use for health staff and patients. They were designed with the idea they can be rolled out in multiple languages and placed in waiting areas or entry points to health facilities. A total of 944 Kit A's and 72 Kit B's arrived to Maiduguri on the 8th of May and were offloaded in the Danish Refugee Council's warehouse. A distribution plan was made by the logistics coordinator for partners to be able to collect and further transport kits to their respective health facilities. Mentor conducted the transportation of the kits to the Ministry of Health-run facilities. The distribution began on the 17th of May and ended on the 18th of June. The survey was conducted by 20 surveyors in 35 health facilities in Jerry and 26 health facilities in Maiduguri Municipal City, or MMC, for a total of 61 completed surveys. Surveyors with previous experience conducting such activities were selected and provided with a further 1-day training course by Mentor. During the training session, all data forms and methodology were thoroughly explained, and a practical session was conducted on how to fill the forms out in a relative time frame. Survey round 1 was conducted on the 13th of July, the second on the 26th of August, and the third on the 22nd of October. Prior to kit distribution, the number of nurses, doctors, cleaning staff, and the catchment population of each surveyed health facility was recorded. For Jerry, 10 health facilities were surveyed 3 times, and for MMC, 5 health facilities were surveyed 3 times, and thus included in this analysis. As you can see, Jerry had significantly more cleaning staff per health facility than MMC, and MMC had a larger catchment population than Jerry. We collected a large amount of baseline observational data, but for the sake of time, I've selected only a few to discuss. While there is some variation between the survey rounds, in general there were functioning hand hygiene facilities at points of care for the majority, and healthcare workers washed their hands between patients and at key times. 97% of Jerry and 100% of MMC surveyed staff, in response to the question, "What impact have the products had on the health of staff?" responded, "More healthy." 93% of Jerry and 100% of MMC survey staff found the pictograms to be clear and understandable. However, only 7% of Jerry and 0% of MMC surveyed staff found the pictograms to be durable. In response to the question, "Which products do you think are not useful?" the majority of those surveyed reported nail brushes in the first round. In the second round, 100% of MMC staff reported no products, potentially indicating that as staff had more exposure to the products, they better understood their utility. In the second survey round for Jerry, however, staff were split between no products and the nail brush, and the third round was also mostly no products and the nail brush, with a few other products mentioned. So this illustrates the variety in terms of staff perceptions of the products. 100% of MMC staff have seen an increase in the number of patients accessing the facility for all 3 survey rounds. 100% of Jerry staff have seen an increase in the number of patients accessing the facility for the first 2 survey rounds, and 70% for the third round. However, 80 to 100% of surveyed staff reported there was a sufficient supply of all disinfection kit products. This indicates that even with a varying number of patients, staff still felt the kits contained the right amount of product. In response to the question, "Do you think the health facility is cleaner than the last time you visited?" greater than 80% of surveyed patients responded yes. Note that this was a larger sample size as 3 patients were surveyed each round. Mentor also conducted a short health partner survey for the 8 partners receiving disinfection kits. 100% found the kits useful, and 100% would also like to receive the kits again if they are available. In terms of ideas for improvement, one mentioned that a single standard package may be preferable to the Kit A and Kit B categories that we distributed in this project. Heightened insecurity after survey round 1 led to only 15 of the 20 facilities being surveyed 3 times, therefore creating a smaller sample size. It was deemed too operationally risky to send survey teams to deep field locations such as Manguno, Dikwa, or Ngala. Therefore, all surveys were conducted in the accessible local government areas of MMC and Jerry. Only primary healthcare facilities were surveyed, thus the results may not be representative of hospitals that received the disinfection kits. Therefore, these results may only be applicable to primary healthcare facilities in Jerry and MMC. The results of the survey were very positive. Healthcare staff found the pictograms and the products to be useful, patients found the facility to be cleaner, and health partners found the kits to be useful. However, the vast majority of those surveyed did not find the pictograms durable, and nail brushes were the most commonly cited least useful product. This may point to a need to adjust pictogram material, such as laminating them. Future campaigns should provide more education sessions on the utility of nail brushes, as staff may not be familiar with them. Overall, this project can be seen as a success, and partners and staff have already requested future kit distributions. Thank you for listening.